episode. I'm really excited today because I get to talk with a friend and OB here in Lincoln about COVID vaccine and COVID in pregnancy. Dr. Alyssa Rutan, she is a OBGYN at Bryan Women's Care Physicians, and she takes care of moms in pregnancy and throughout life with everything reproductive, women's health wise. And we're going to talk today about COVID. So Dr. Rutan, could you tell me a little bit specifically about what COVID in pregnancy has been like so far? What you have seen, I have heard that it's more serious in pregnant women than the general population.
Yeah, over the last, 10 or 11 months, we have seen that what you say definitely holds water. Pregnant ladies, they have some specific risks when dealing with COVID and pregnancy. So because of some of the physiologic changes that accompany pregnancy, pregnant women are at an increased risk of having more serious disease. So with that, we are seeing a significantly increased risk of admission to the hospital, of having to consult our maternal fetal medicine colleagues and our ICU colleagues, having them be admitted to the intensive care unit. We're also seeing a significant increased risk of having to have those patients on mechanical ventilation or be intubated. Pregnant ladies have, as you know, a decreased functional residual capacity. So their lungs kind of are not at the same, they don't function at the same level as people who are not pregnant. And so when infected with a respiratory virus, like we've seen this with influenza, for decades, but now with COVID, which can, primarily manifest itself in a respiratory way, that they're unable to handle the virus as well as their non-pregnant counterparts. So just specifically with the mom, increased risk of more serious disease, admission to the hospital, ICU admission, and then intubation. And that's just with mom. So the other thing we're seeing are increased risks to the babies. So increased risk of iatrogenic or indicated preterm delivery, because mom is not doing well, because mom has to be well oxygenated to be able to carry that blood through the placenta into the baby.
Sure.
And baby well oxygenated. So if mom can't keep her oxygenation stats above 90%, then we're not going to be getting a good oxygen supply to the baby. And so babies can display like non-reassuring fetal heart tones, when we monitor babies. So increased risk of cesarean delivery, indicated preterm delivery, so admission to the NICU. We're investigating the possibility of increased risk of preeclampsia because of the potential effect on microvascular, microvascular disease, as well as potentially increased risk of growth restriction and stillbirth. So these are all things that were not recognized right away because, of course, we'd never dealt with this in pregnancy before. But now looking back, these are kinds of the things that we're recognizing as being specific pregnancy and COVID infection.
Well, I hadn't considered specifically the preeclampsia one, but I'm glad you brought that up because I actually remember from my OB rotation days that preeclampsia is a blood vessel, blood clotting issue at the tiniest level. And so I hadn't considered that, but we do know now about COVID that it puts you increased risk for clotting and all of those things. So I can see how that could play together in my mind too. Now, it sounds like obviously we don't want anyone to have coronavirus, but especially for pregnant moms that you're at quite an increased risk if you get coronavirus while you are pregnant of needing to be hospitalized, needing to have oxygen or other respiratory support, and then even having to do preterm delivery or having issues with fetal growth and all those things. So certainly something to avoid however we can. And we know that, masks and distancing and all those things work well to help. But lately we've been hearing a lot more about the vaccine. And I know that locally we're at the point where we're getting to be able to vaccinate the general population. I just got an email this morning asking, to send out this link to share with people about the Lincoln sign up for the COVID vaccine. And I'll make sure and put that in the notes below so that people can click through to do that. But there's a lot of questions around pregnancy and the COVID vaccine. So can you unravel that a little bit and kind of share with us what you're telling parents or patients and what you're telling those that are expecting in terms of, should I get the coronavirus vaccine?
Right. So whenever we discuss vaccinations or medications in pregnancy, there's always a necessary risk benefits analysis that takes place.
Right.
So specifically with COVID and the coronavirus vaccine, we're essentially weighing the risks of pregnant people getting COVID versus the risk of administering the vaccine, right? So, all of those other things we're kind of looking into. It'll be interesting a year from now to look back and see, to actually do more in-depth studies as far as some of the things that we think might be associated with COVID and pregnancy, like the, increased risk of blood clotting. It makes sense that
Sure.
we have pregnant ladies are already at an increased risk of having deep venous thrombosis or blood clots, or, the potential for the growth restriction, the preeclampsia. So those are all things that we're looking at. But it's, as you said, it's been quite clear that pregnant ladies are at an increased risk of admission, requiring mechanical ventilation, ICU admission. So those are the kinds of risks that we're hoping to mitigate, right? So unfortunately, pregnant ladies were excluded from both the Moderna and the Pfizer trials.
Okay.
This is not uncommon because we typically
Sure.
don't, a lot of our trials with pregnant ladies are retrospective trials. So they were excluded. But between the two trials, about 70,000 patients were studied, and looking at the safety profile and just knowing what we do about the mechanism of action of the vaccine. We have to use that to extrapolate safety for pregnant patients. And at this point, the Society for Maternal Fetal Medicine and American College of Obstetricians and Gynecologists, as well as the CDC, they've all, sort of weighed in on this and said that we really should not be excluding pregnant patients from being able to receive the vaccine just because they're pregnant. So this does require, a conversation with their obstetrician and also an evaluation of their risks, because certainly, the pregnant patients that I take care of who are nurses over in the emergency department or, in the tower, their exposure to COVID is constant, I'm sure. And,
Sure.
They have a much higher risk profile than a pregnant patient who's been working at home for the last 10 months, whose partner is also working at home, who is homeschooling their children. There's a different risk profile. Some people are able to socially distance more easily than others. And so we have to take the patient's, risk of exposure to the disease and the risk of what happens if she gets the disease versus the risk of the vaccine. Now, in general, with pregnancy, it's the live attenuated viruses that are contraindicated in pregnancy. So just by the mechanism of action of the way this vaccine works, the fact that it's a messenger RNA vaccine, just by the mechanism of action of how it works, it does not get into, as you know, the nucleus of our own cells, and would not be able to get into the nucleus of the fetal cells. So in theory, this really should have the same safety profile as it does for everybody else who's not pregnant, meaning that, we have established pregnancy or safety in the non-pregnant population with the studies that they've done. And so really with the risk benefit analysis, that's something that we're discussing, but in general, we're saying that it should not be withheld from the pregnant patient.
Okay. So it sounds like based on the mechanism of action of the Moderna and Pfizer vaccines, and in the future, we'll have to have you back on to talk about the other vaccines as we get more vaccines in the future. The mechanism of that is not of concern for any issue with baby, because it shouldn't get into the nucleus of his or her cells, just like it doesn't get into the nucleus of our own cells in our muscle where the vaccine is injected and everything like that. And we're weighing the risk and benefits where there's the risk of the unknown of the vaccine, of course, that we don't have years and years of experience with it. I know, or I've read that there were, people in those trials that got pregnant and didn't have any specific issues. They weren't pregnant when they entered the trial, but then through the natural course of things, got pregnant while they were in the trial. And then we have to weigh that risk of the unknown with the risk of getting COVID in pregnancy, which, as you've said, is all the different things that are heightened because of the differences between somebody that's pregnant and somebody that's not pregnant with the physiology, that it puts them at a heightened risk. And it sounds like what you're saying is for those that, especially those that are exposed on a regular basis, we're talking people in the healthcare setting, I imagine teachers and those that work in grocery stores or on the front lines and aren't able to work from home, that the balance then would lean towards having that conversation with the OB, potentially getting the vaccine because of the risk of COVID in pregnancy. Is that what I'm understanding?
Yes. Yep. That's a very that's a very good recap of my long-winded answer. So, yeah.
So you're telling patients, from what I'm gathering, that if they have a risk of getting coronavirus, that it's safe to get the Moderna or Pfizer vaccine at this point with what we know, and that it is worth the risk of the unknown of the virus versus the risk of the or of the vaccine versus the risk of getting COVID, that it favors getting the vaccine.
I would say yes. In general, it favors getting the vaccine. And, I totally understand, there's going to be a lot of hesitance to do that with this being so new and the fact that, we were able to get the funding and get it rushed. So certainly with this vaccine, I understand people's hesitancy with receiving the vaccine. But I do believe that in general, it is, I think that the benefits of the vaccine outweigh the risks, and that the risks of actually getting the infection outweigh the risks associated with the vaccine.
And I think one thing to highlight in what you just said there too, is that we still have a little bit of time before the general population, those that aren't at the level one risk, those that are in healthcare settings, teachers, people in the front lines, dentists, those sorts, are going to get access to it. And so by the time that the general population, those that are able to work from home and everything like that, actually have access to the vaccine, hopefully sooner than later, but we still have a little bit of time to collect additional data. And we know that there's a lot that have gone before us. Even, I've talked with a lot of nurses that are pregnant that have gotten the vaccine because they, have looked at it and talked with their OB and made that decision too. So by the time most people will have access to get it, we'll have even more data.
Absolutely. Yep. There's a lot of nurses and doctors and respiratory therapists and physical therapists and folks who work in the hospital who are pregnant who have received the vaccine. So yeah, hopefully we can initiate those studies, quickly in those patients to establish some safety data.
Now let's shift gears, because I think we've established, the case in pregnancy and that it should be considered to get the vaccine. What about breastfeeding moms? Can you talk about that a little bit too? Because I think that's a related subject where you have a nursing mother who is still kind of your patient in that post-pregnancy, postpartum period. What are you telling them about the vaccine while nursing?
I feel very good about the vaccine and nursing.
Okay.
And, when pregnant patients get COVID, obviously delivery looks a little bit different for a pregnant patient with COVID. But if they would like to try to breastfeed and they're COVID positive with an active infection, we do encourage that. So that looks a little bit different. We ask the patients wash their hands before they touch their baby, that they wear a mask while they're nursing their baby, and that while they're not nursing their baby, that they place the baby, 6 feet from them. But given the fact that we have successfully had COVID positive moms actually breastfeeding their baby, the fact that the vaccine will just mimic that spike protein and
Sure.
hopefully when the patient comes in contact with the COVID virus, launch that antibody response. Hopefully those antibodies then will get passed through the breast milk. So we're hoping with the vaccine that will be the same, the same outcome, so that with the vaccination, we'll have passive passage of antibodies through the breast milk to the infant. So definitely encouraging breastfeeding moms to get the vaccine.
Okay, so you said a lot right there, and I want to unpack that a little bit because I think that was really helpful. The way that you laid that out there is that there is the potential when a mom that's breastfeeding gets the vaccine, they'll make antibodies, and then those antibodies can get from mom into the breast milk, and then baby gets those antibodies too, and may have some then degree of protection from COVID, which is, kind of what parents worry most about is their baby rather than themselves. Right. So breastfeeding mom gets vaccine, she's doing what the only things that one can to give some antibody to baby, because we won't have vaccine available for babies for a while now. So the fastest way to protect baby would be to get the vaccine either while pregnant or breastfeeding, and then continue breastfeeding so that baby gets exposure to those antibodies.
Correct. And again, we just need more time to see how that plays out and ensure that that's what's happened. But that's what we've seen with other viruses, influenza, RSV, the mom launches this antibody response and then they get passed through the breast milk and then confer some pertussis. That's another one, that we do and see, administering Tdap. So those we have studied and it does appear to confer some benefit. So we're hoping that's what's going to happen with the COVID vaccine as well.
Awesome. So it sounds like no concerns about moms that are breastfeeding getting the Moderna or Pfizer vaccine. The other thing that I had read that makes sense to me from a biochemical perspective too is mom gets the COVID vaccine and goes to nurse her baby later in that day. She's got the mRNA circulating in her arm. mRNA is not a very stable molecule. And so even if it were to get into her bloodstream, even if it were then to get into the breast milk, that breast milk goes to the stomach where it would get degraded in the baby's stomach. So my reading of the situation is that you can expect 0 to, mRNA getting from mom to baby and actually having any impact. If even a tiny amount were to get into breast milk, then it would just get degraded in the stomach. Mm-hmm. Cool. Now, if you still have time, I would love to talk to you about fertility, because I think that's one issue that a lot of people have been asking me about. And I kind of would love your input on this too, is the COVID vaccine and fertility. If we have a mom that is trying to achieve pregnancy, or somebody that's been struggling with infertility, is there a different decision point or considerations with regard to the Moderna and Pfizer vaccines?
So for us in the OBGYN world, we're not really sure where that, I would say this is a myth that we are having to dispel, that the vaccine predisposes patients to infertility. And that is very scary because we have a lot of, moms who are struggling to get pregnant, or patients struggling to get pregnant. So I would just say that is a myth that we're having to dispel. And we think that it came from a rumor that one of the spike proteins would mimic one of the proteins on the placenta, and that antibody then would attack the developing embryo. But those two things share less than 1% of the DNA, and so it would not act against any developing embryonic tissue. That the antibody would not act against any of the developing embryonic tissue. So thankfully, that is a myth, and the vaccines will not predispose you to fertility problems.
Well, that's what I read too, was that there was like 4 amino acids out of, thousands of amino acids that were the same. And so they were saying that because of that, there could be some risk. But it sounded like saying like everything with wheels is a car, when really we're talking about a car and a tricycle and a cart that you push around the office, all being cars because they have wheels. And so it seemed like that was clouding the picture and leading to a lot of hesitancy and misinformation. And so I'm glad that you set the record straight, that what I'm hearing you say is that if you have a patient that is trying to achieve pregnancy or dealing with infertility issues, that there's no cause for alarm or cause to say, I can't get the COVID vaccine, I'm going to accept the risk of getting COVID because we're trying to achieve pregnancy.
I have absolutely no concerns about patients receiving the vaccine who are attempting pregnancy.
Awesome. Okay, those were the main questions that I wanted to answer. Is there anything else that you want to leave patients with, people to understand that you're hearing on a regular basis?
You know, I'm very encouraged with the development of the vaccine. I hope that we're somehow able to get it to roll out faster and get it to the general population very quickly. I guess you've probably discussed some of the side effects of the vaccine as well in some of your podcasts. Just from some of the patients that I've been taking care of, many patients are just reporting very minor side effects, arm soreness, mild fatigue, mild headaches. So after the second vaccine, I did have more of the muscle aches and feel a little bit more sick. But in general, patients who have had COVID compared to the patients who have had the vaccine, they tell me that it's, the side effects are much milder with that vaccine than actually the virus for the most part. And the symptoms seem to only last about 12 hours. So,
right.
Just anecdotally, I would say that the side effects that patients have been reporting to me and that our office, staff have been reporting to me have overall been mild.
That's what I've heard too. I talked to a lot of moms that are nurses or respiratory therapists or in the hospital or teachers or whatnot. And that's been the experience that they've had. And I've talked with my staff as well who have gotten it, and whether they had COVID or not before that some arm soreness and then maybe a little bit of like feeling a little like you have the flu for 12 hours or something like that. But certainly better than being out of work for 2 weeks. The risks that go along with COVID, the risks of spreading it to others in your household or in the community and all of those things.
Right. I guess the one last thing that I want to say is just to be like perfectly transparent that the only reason that we are here is to take care of patients. We just want the best thing for our patients. And so, I've seen on some, social media that there's some concern about, that we like get paid to say things, about vaccination. And,
right.
Of course, Pfizer and Moderna have not paid me to say anything about the vaccination. Obviously, we, clinics in general lose money from vaccines. This is all coming from the government. And so, my anybody who I encourage, to get the vaccine because of the risk benefit ratio, if you fall into the higher risk category, it's only because I really care about them and I just don't want them to get sick. So I would just encourage people to continue to mask and keep their, keep their safety mechanisms in place, only gather with people that are inside the nuclear family. This is where I'm seeing a lot of patients say that they have gotten the virus is, we got together with my brother and my sister-in-law because they're in our bubble. And,
right.
So I would say we're so close to getting the vaccine rolled out and hopefully, this fall returning back to normal. So just hang in there for just a little bit longer. Everybody's been doing such a good job. I'm just so encouraged by all my pregnant patients. They're just really being very careful and really taking this seriously. And I'm so glad to see that. So I think that we're really close. And so I think we just need to hang in there a little bit longer. I'm really encouraged by the development of the vaccine.
Amen. I echo everything that you just said, that we are so close. And if people can just hold out a little bit longer from the total return to normal, then we will get through this and be over the hump. And I so appreciate you talking about the reason behind what you're saying and what we're all saying in the healthcare community comes from a place of caring. And I know that you have to go, but I have to share a caring story that is embarrassing to me and is, shows your character too, Dr. Rutan, is I was a third year medical student, first rotation. You were an intern on OB, first day. This was my very first patient that I ever seen. Of course, they were pregnant, and I'm standing in the corner with my short white coat on, totally wide-eyed and oh my gosh, what is going on? And first time in my life, I just get this massive nosebleed. And it was so embarrassing because you're there trying to deliver this baby. And I'm I don't know what to do. I have a terrible nosebleed over here. I'll just stand here.
That.
I know. Well, because you were an intern and you were, busy taking care of patients 80 plus hours per week and everything like that. But I will say that you helps me get new scrubs and were super helpful and made me feel less like a complete fool of a medical student. And it was on my very first day. So I still have that memory of you.
Oh my goodness,
Yes.
that must have given you PTSD.
It did. I know. I'm just waiting for the next time, but I'm more comfortable with blood and guts and all those things now. So thank you so much. This has been so helpful.
You're welcome. Let me know if there's anything else I can do, but it's been really nice to talk to you too.
Awesome. Thank you so much, Dr. Rutan. Have a great day.
You do the same.